My name is Andrea. I'm going to be filming my HEENT exam. This is my name badge. It's not Maryville, but it is my work badge. I'm going to do a quick scan of the room, and then I will have my test patient read the statement. So here we have, I have a table with all of my tools there, my things. Okay, you can go ahead and start reading that statement.
I voluntarily give Maryville University permission to record any image and or voice and grant Maryville University all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. I give my express consent for this information gathering and physical assessment to be filmed and posted in the student's course shell for access by faculty and students at Maryville University. I further acknowledge that since the recording is for educational purposes only and the information is not meant to be diagnostic, therefore Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student in any of their devices as soon as it has been reviewed and graded by the instructor.
Okay, thank you. I'm going to start my exam now. So I have washed my hands prior to this exam. Knock, knock. Hello, my name is Andrea Dewar. I'm here to do an exam on you. Can you please tell me your name and date of birth?
Leonard Duarte, 5'11", 73.
Excellent. I'm going to do an exam of your head, ears, eyes, nose, mouth, and throat, and I'm going to be talking aloud and telling you what I'm doing as I go along. First, I'm going to start with your head. I'm going to feel around here. I'm looking and feeling for any obvious deformities, lumps, bumps. I'm looking for size, contour, symmetry. Are you having any tenderness
No.
when I palpate over your head? Hair pattern looks good. I'm going to look at your face for your facial expression, for symmetry. I'm looking for any edema, masses, or involuntary movements, which I don't see any. I'm also going to check your facial nerve here. I'm going to have you smile, I'm going to have you frown, and then I'm going to have you puff out your cheeks and raise your eyebrows and close your eyes shut. Excellent. I'm also going to check your trigeminal nerve, so I want you to close your eyes and tell me when you feel me touch your face.
Yes. Yes. Yes.
Excellent. And lastly, I'm going to check your accessory nerve by having you shrug your shoulders against my hands. Excellent. And turn your head to the right and to the left, or to left and right. Excellent. All right, I'm going to look down to your eyes here. I'm looking at your eyelids, your eyelashes, your palpebral fissures, and your eyebrow alignment. I do not see any ptosis or any hordeolum. I don't see any obvious issues with your eyelashes. I'm going to have you close your eyes. I'm going to just gently palpate over your lacrimal apparatus and your eyes. Do you have any pain when I touch your eyes? Okay. I'm going to have you look up while I pull down, checking your conjunctiva is pink. I do see some injection, or what we call like red vascular stuff in your the whites of your eyes. But I don't see any drainage or nodules or anything like that. I'm looking at your cornea, your pupils and your lens, excuse me. Your pupils are the normal size of 3. They're round. Your eyes are symmetric. I don't see any opacities in your eyes. I'm going to do a test of your pupillary response, which is one way that we check the oculomotor nerve. I'm going to have you look right at me, and I'm going to check your pupil restriction to the direct eye and also to the consensual eye, which is good on both sides, or both of those eyes, and on this side as well. And then I'm going to have you keep your face to mine, but look behind me with your eyes, and I'm going to have you focus in on this pen. Okay, go ahead and look at it. And I saw some constriction there as well. I'm going to have you face this way and back up just a little bit. I'm going to give you this. We're going to check your optic nerve by doing the visual acuity test and the visual fields test. So I'm going to have you from 6 feet away. I'm going to use the Snellen chart. I want you to read the smallest line that you can read.
LTFPH.
Okay, I'm going to cue you to cover your other eye and read the smallest line you could read, but in reverse order.
HPFTL.
Okay, and do you wear correction at all? Okay, you can go ahead and keep that. I'm going to, you have 20/20 in both eyes, by the way. I'm going to be testing your visual field. So if you can cover your right eye, I'm going to go ahead and cover my right eye. I'm going to put this down actually. And I want you to tell me when you can see my fingers come into view.
No.
Okay, cover your other eye. I'm going to cover this eye. Tell me when you see my fingers come into view. Excellent. I'm going to check your extraocular eye movement. I want you to look at me and follow my pen light with your eyes. And up. We're testing your oculomotor, trochlear, and abducens nerves here. And I'm also looking for nystagmus and lid lag, and then follow it to your nose. Excellent. Everything looks good there. I'm gonna dim the light real quick and do an ophthalmoscopic exam. I can't say that word today. I'm gonna have you just turn, that way so that the camera can see what I'm doing here. I'm gonna I'm gonna try not to blind you. I'm going to hold my hand to your head so that I don't accidentally bump heads with you, okay? So I'm coming in and I'm looking, if you can look far out, yep, I'm looking for the red reflex, which I see. And I'm coming in and I'm looking at the inside structures, so the optic disc, the macula, the fovea. And I'm going to have you kind of come in here, yep. Same thing, I'm going to hold your head so I prevent from hitting you and look far away. I'm looking for that red reflex as I come in. I see the red reflex and I'm checking the structures behind there. I don't see anything abnormal. Okay, next I'm going to be checking your ears. And let me turn the light back on. Initially, I'm just going to be taking a look and palpating the auricle and the surrounding tissues. I don't see any obvious deformities. Do you have any pain at all?
No.
Okay. I don't see any foreign bodies that I can just see with my eye. Then I'm going to use the otoscope to look in each one of your ears. If you can kind of turn this way again so that I'm in view of the camera. Excellent. I'm going to be looking for any foreign bodies, swelling. I'm just looking at the ear canal right now. Any excess earwax, which we call cerumen, or drainage, or anything abnormal. I don't see anything at all. I'm going to pull the pinna up and back so that I can visualize the tympanic membrane, which I see is pearly gray, and I'm looking for landmarks, the umbo, the handle malleus, and the light reflex. This way I'm going to do the same thing, about right there, I think will work. I'm looking at the ear canal again. It looks clear of any drainage or swelling, and your tympanic membrane looks good here as well. Now I'm going to be testing your vestibular cochlear cranial nerve by testing your hearing. If you can cover your right ear, I'm going to have you repeat what I whisper to you.
Baseball.
Okay, cover your other ear. I'm going to have you repeat my word.
Flower.
Excellent. And then just two more tests of your ears. I want you to tell me if you hear this more in the right, more in the left, or if you hear it in the same in both ears when I put this on top of your head.
Same.
Okay, excellent. And then I'm going to be, tell me when you stop hearing it from behind and when you stop hearing it in front of your ear.
Stop.
Okay.
Stop.
Okay, excellent. And then on the other side.
Stop. Stop.
Okay, and in both instances, the air conduction was greater than the bone conduction. I'm going to take a look at your nose. I'm going to just gently palpate. I'm palpating for any tenderness that you might have. I don't see any lesions or lumps. I don't feel anything that I think is obstructing your airway. I'm going to block your nose. I want you to inhale in and out. Perfect. And your other side. Okay, your nares are clear. While I'm here, I'm going to palpate your frontal and maxillary sinuses. Let me know if you have any tenderness at all. Okay, excellent. Now I'm going to go ahead and use my otoscope to examine your nose here. I'm going to put my thumb on the tip of your nose, and I want you to just tilt your head back just a little bit. I'm looking inside. The mucosa is pink. I don't see any foreign bodies. I don't see any drainage, redness, lesion, polyps, and I also don't see any signs of a perforated septum. I'm going to check your first cranial nerve, which is your smell. If you can go ahead and close your eyes. I want you to cover your right nostril, and I want you to smell and tell me if this is sweet or savory.
Sweet.
Okay, I want you to cover your other nostril, tell me if this is sweet or savory.
Savory.
Okay, excellent. Okay, moving on to your mouth. I'm going to be looking first at your, I'll just use this pen, it will work. I'm going to be looking first at your lips. For him, they look pink, moist. I don't see any cracks or swelling. I don't see any lesions or anything like that. I'm going to have you open up your mouth, and I will be just moving your tongue around so that I can see inside. I'm looking at your gums to look, they are pink, they're smooth. I don't see any ulcerations, I don't see any swelling or any lesions or anything. I'm looking at your gums and at your teeth. I don't see any retraction, bleeding, ulcerations, any loose or missing teeth. Okay, I'm gonna have you stick your tongue out for me. It looks midline. Move it to the right and the left, please. I'm checking your hypoglossal cranial nerve. I also looked at the texture of your tongue, which was red, smooth, and moist. And then can you put the tongue to the roof of your mouth? I'm going to check the ventral side of your tongue. Perfect. Then I'm going to have you extend your tongue out. I'm going to press the tongue depressor down. I'm going to have you say ah. I'm looking at your posterior pharynx, your uvula, and your soft palate. I'm looking for rise and fall of your soft palate when you say ah. I'm looking for your gag reflex. And I'm also looking for any drainage, any swelling, any ulcerations, or anything abnormal back there. Okay, so open up real big and wide. Put your tongue out. Perfect. And I'm going to verbalize that I checked your gag reflex. Okay, lastly, I'm going to take a look at your throat. If you can look up, I'm just looking for any obvious signs of I'm sorry, I meant to say that that test that I just did with your gag reflex and that was checking your glossopharyngeal and vagus nerves.
Okay.
So down here at your neck, I don't see any obvious scars or edema masses. Do you have any pain here at all?
No.
Okay. And I'm going to palpate your lymph nodes to see if I can palpate any of them, if I can, with the size, symmetry, and if you have any tenderousness. So let me know. I have pre-auricular, posterior auricular, occipital, tonsillar, I'm going to get into your beard, submandibular, submental. I have your superficial cervical, posterior cervical, deep chain cervical, and your supraclavicular. I don't feel anything there that is out of the ordinary for me. I'm going to take a look at your trachea with my thumb just to make sure it's in the right spot. It does appear to be midline. Can you swallow? Okay, excellent. And the last test I'm going to do is I'm just going to look at your thyroid. If you can give this a hold for me, I'm gonna touch your neck from behind. Okay, with both my hands. I'm just locating the landmarks, which is the isthmus and the lateral lobes. If you can go ahead and take a drink of water. Okay, excellent. That looks great. Any tenderness there?
No.
Okay, thank you so much for being
You're
my
welcome.
test patient.